I read somewhere that in a matter of days from now, the NHS is going to sell all of our data and details. What could you tell us about that?
That is actually true, George. So on the 21st, the NHS data, all data taken from the time of your birth records, right up until the time of your death, and that would include maternity data, includes data of your mental health, data of your sexual health, data of your sexual preferences. So all kinds of extremely sensitive data that really you would only share with your GP on the basis that they're going to use it, or health professional on the basis they're going to use it to help to treat you, has become a valuable commodity and resource for a couple of reasons. One, for research, and that's how we're being encouraged to think about it. But there's another emerging threat, which is that, increasingly, as waiting lists increase, before the pandemic, waiting lists were already at an all-time high. Coming out of the pandemic, we know that waiting lists are about 5 million people in our country waiting for operations. And the president of the Royal College of Surgeons weighed into this debate this week in a slightly unhelpful way, I think. He said, look, if people come back to the NHS as they're doing, there's going to soon be 10 million people on the waiting list. And he said we need a radical solution. We need to think like grown-ups about this. And he pointed at increasing specialisation and separation of surgical services on the one hand, and to carry on with our relationship with the private sector, where we've been giving away actually tens of billions of pounds to the private sector to subsidise them during this time. Now, the private sector themselves say the largest and most profitable section of healthcare, which is growing at the moment, is the self-paying sector. And you can see those things are directly linked. If there are 10 million people waiting for operations, and some of them may be relatively routine, but many of them will be life-changing, and some of them will be life-saving operations. And if you're waiting for those and you simply think, well, whatever I've got, my health is the most important thing, I just need to get around this incredible wait, no matter how much you might support the NHS, that's the reality you're presented with. Of course, people will go into the private sector to try and look for a solution to try and get around that queue. And that queue has not come out accidentally. That's become as part of deliberate policy, by reducing capacity and now having sufficiently reduced capacity that people are waiting for ambulances, people are waiting for operations, and the answer they get is to their complaints, oh, sorry, we were busy, sorry, we don't have capacity. So those people have been forced into the private sector. Now some of them will self-pay, some of them will have insurance. And insurance companies currently rely on, if you've ever gone through the process of insurance for a mortgage, but equally it's the same for health cover, they will rely on a questionnaire that they give you, a very detailed questionnaire, and what they will tend to do is exclude you from coverage from all the conditions you have already had. So all this data, which is going to go to unknown third sources, but something that's been very clearly driven towards, it will be available for sale. And it's quite clear that currently we're looking at the reorganization of our healthcare system, and large insurance companies are coming into the management of these clinical networks. Clinical commissioning groups are being run by health boards, and the insurance industry and private medicine will have a large part to play in those. And they will be the ones actually making the running both in the NHS and increasingly outside the NHS. And for them to have overall access to masses of patient data is clearly going to be key for them to be able to derive maximum profit. But it's not going to be key in either protecting information of patients who have quite legitimately surrendered it to their healthcare professionals to help them be treated. That will not be respected. And it's not going to be the best thing for actually delivering them insurance-based care, because they will find, as the Americans have found, much to their chagrin and regret, that actually when they need healthcare the most, that is the healthcare that they're often least able to access for conditions or predispositions that they have. So it's extremely sensitive data. It is happening on the 21st of June. It is possible to write to your GP and opt out. I will post perhaps on my Twitter feed a link to some articles about this, and also to some documents about how you can opt out. I personally will be opting out. I'll encourage my family to opt out. It is part and parcel of a number of packages delivered by a series of administrations, Labour and Tory, aimed at persistent privatisation of our NHS. I think it's a really clear and present danger to patients and to our NHS, George.